Recording going. Welcome to the information session for special education for May 6th, 2025. Glad everybody can make it. We know it's, getting down to the end of the year, and so today on our agenda, we're going to have some OSIS updates from Peter. We got some SC Teams updates from Skippy. I think Katie has a few things from EdPlan SC. Sherry Evans is going to share some DSS updates. And then Angie Neal's going to share some clarifications of key terms related to speech language. And click to the next slide. Okay, and agenda item number 1, Peter, you are up with some updates.
Good afternoon. Just a few quick things. As far as, what we've heard, obviously everybody is concerned about the federal level and what's going to happen. From what we've seen, it appears that they'll continue to keep the same funding level for IDA. At least that's the preliminary ones. Obviously, we follow that closely, and we'll wait to see what that is. They haven't informed us of our allocation for this year. We're hoping and anticipating that it will be the same state allocation that we received last year. There's been some talks about changing the structure of it, whether it's just issued as a block grant rather than an individual grant with more discretion to the state. That has yet to be seen. It's been proposed by the White House, but would obviously have to get congressional approval before that would be a reality. So we'll wait to see what happens on that front. The other piece of information that I wanted to let people know about is that we did send out a save the date for fall admin, but as it turns out, the conference center that we were booking is closing. So that's no longer available. So we're going to have to relook at that. We also were made aware that the National CASE Conference is occurring in that same week that we were looking at. So we're going to regroup, look at it again. So we'll send out an email to this effect as well. But the bottom line is you can disregard the save the date for fall admin. We'll be coming forth with more information. So ironically, with the place, the Embassy Suites where we had it last year has closed. The place that we were anticipating doing it this year has closed. A lot of the Midlands event centers have kind of either changed their policies or have closed. But we'll find a place. We still plan on having a get together. We may need to be a little bit more creative in the way that we have it. It's also become considerably more complex for dates because of the varying school district calendars. They vary now more than they had in the past as far as when school districts are starting and the break times and different breaks throughout the year. So we're working with those as well. But we think we have some creative solutions. So just be on the watch for some more news probably in the next month or so as far as our revised plans for fall admin. But we definitely love to see you guys and don't want to miss that opportunity. So we will be planning something else.
Cool. Thank you, Peter. And for our agenda item number 2, Carrie is here from from Skippy. And Carrie, if you're ready, here's your first slide.
Thanks, Lisa. So just a couple quick updates about some universal professional development opportunities that we have available. The first one is our Early Childhood Inclusion Conference in September. Our call for proposals is currently open through May 16th. And spoiler alert, we're going to be extending that. You guys are in the know now, but we'd love for you all to consider submitting a proposal. We value all of the knowledge and experience that you bring, and this year's theme is Keys to Unlocking Potential, and our big goals are providing the participants with strategies to embed specially designed instructional opportunities throughout the early childhood continuum of service delivery, and empowering participants to employ data-informed decision-making to improve child outcomes. So if you think you have a great idea for a proposal, we'd love to hear it, and please help us spread the word. Next slide. And the next one is about an opportunity on June 6th. And we feel your pain, Peter, because this Champions for Young Children Symposium was originally at that same venue that fall admin was, but our wonderful events coordinator was able to scramble, and now it is going to be held at Midlands Tech. This is a great cross-collaborative opportunity for everyone involved in early childhood, and we are offering CEUs and childcare training credit for this. And the theme this year is around strategies to prevent suspension and expulsion in early childhood settings. Registration is open for a few more weeks, and we have some wonderful featured speakers. Emily Malin will be coming to talk about addressing exclusionary discipline and doing a national look at policy to practice. And our OG pyramid model friend, Mary Louise Hemeder, will be also joining us to talk about the power of prevention. And Mary Louise has been involved all of her work in the early iteration to really get the pyramid model framework set up. So if you are available and interested, this is a great professional learning opportunity to join. And then I'm sure you're all aware of SC Team Summer University coming up in June. There are some fabulous sessions that all of the TA centers are hosting. Just sharing a little bit about what we have for early childhood. On the 10th, we'll be doing some sessions around the pyramid model and what pyramid pieces in our state is offering. The morning session is for anyone who's been thinking about doing program-wide implementation, but feels like it's a lot to kind of bite off, and you don't want to bite off more than you can chew. So this will help you really explore what implementation looks like and get started with some resources.
I'm on.
And then the afternoon session is about a new opportunity we're offering called CORE. Let's see if I remember what that stands for. Connect on Reframing Expectations. And this is really to support helping districts look at challenging preschool behaviors and really thinking about a process and a plan for responding to those. And then lastly, on the 11th, our team at Skippy is offering 2 sessions as well. The afternoon will focus on positive strategies for the preschool classroom. There'll be a lot of really interesting make and take activities for folks that are interested in that, things that you can have ready to go to set up your classroom for the next school year from the beginning of the year. And the morning session will be diving into the new updated early childhood performance factor. So if you have questions about that, that will be a great one to join Melissa Griffin, myself, and Sherry Evans. And I'll pop some links in the chat, but feel free to reach out if you have questions. Thanks, everybody.
Thanks, Carrie. We appreciate everything you guys do at Skippy.
Thank you, Lisa.
And Ed Plan SC updates. Katie, you're up next.
Good afternoon, everyone. I sent out a long email yesterday with lots of updates, lots of exciting updates. And so I'm not going to have any slides today, but that email had a lot of information in it. If you would review it, and if you have questions, let me know. There's a lot of new AR reports on the shared folder in AR for you to access. A lot of those were your requests for those reports. And then also, I wanted to make note that we added a second initial power user training for July 23rd. So we're doing one this Thursday and then another one July 23rd to help with your new hires coming in. Sherry, thank you. She's dropping that information in the chat. So if you said, oh, I didn't know there was going to be one offered in July, and I'm coming on Thursday, but it's a little stressful time for me to come, I want to change, that's fine. Just register for the one in July, and then if you'll shoot me an email, let me know, that you're gonna change. That's all I really have. Just like I said, the email had a lot of information in it regarding AR, office hours, and then a few configuration updates. So appreciate everyone's feedback and time. And if you need anything, just let me know. Thank you.
Thanks, Katie. And thanks to Katie and Sherry, who were in Columbia College all day doing training there, and then made it in time for our meeting this afternoon. And next up, we have Sherry Evans with some DSS updates.
Good afternoon, everybody. I just wanted to share some DSS licensure updates with you all. These were also shared at the Early Childhood Roundtable yesterday, so you may have heard some of this information from your early childhood person, but I want to go ahead and share it with you all today just to make sure that everybody gets the same messages. So on April the 14th, DSS, Cynthia Lara with DSS sent out an email to districts. That email probably either went to your early childhood person or it may have gone to you regarding some upcoming webinars that will talk about the onboarding process for the DSS licensure. But I want to share with you a specific update that we found out, or several specific updates that we have found out since we chatted last time. So one question that came up was if a school has a program with non-cert up students who are ages 4 and younger, and that program operates more than 4 hours a day, they do require a license. Now, the caveat is a lot of you may have some AM and PM classes. It's based on the site, not the class. So if your AM class has one set of students, your PM class has another set of students, but your site is operating more than 4 hours a day, then that licensure piece would apply to you. So that is a item of clarification that we did not have before. I wanted to make sure to share that with you all today because I know that that may impact some of your special education classrooms. I also want to share with you, there have been some discussions between senior leadership at the department and DSS. They have worked out a phased implementation and a long onboarding process. And during that time, no penalties will be levied against districts. But DSS is going to be sharing a lot of information in the upcoming webinars. Lisa, if you don't mind going to the next slide, we have the webinars listed here as well as the links. These were also in the email that went out, but if you for some reason didn't get that email, it's right here. And questions. Now you may have questions. There is Cynthia's contact information at the bottom. I know some districts are going through the process now, and they have said that Cynthia has been fabulous to work with in the process. So I would definitely reach out to her with questions. My best advice to you is between now and the time that you sign up for a webinar, if you will just go on the website, on the DSS's website, and look at those licensure requirements and think about what questions you have so that you can take those questions to the webinar. That would be the best advice I can give you right now. But again, it's going to be a significant onboarding process. You are going to have time in which penalties will not be levied. Okay. And thank you, Jenny. Jenny has also put Cynthia's email address in the chat. So if you have questions, reach out to Cynthia. Also, I'm sure Sarah will post these slides, so you'll also have access to the links. But if you have any trouble accessing those, I'll put my email in the chat as well. Feel free to email and I'll forward the email to you with the links. All right.
Lisa, it would help if I unmuted, huh? Next up, we have Angie Neal, and she's going to talk about some clarifications of key terms related to speech language impairment. Angie, if you want to come off and turn on your camera, you're on.
All right. So if you'll go ahead and there we go. Okay. So again, my name is Angie Neal. I'm the speech language pathology consultant here at the Office of Special Education Services. And so I'm going to provide some clarification today about some
ideal, but they're going to make it harder for him to catch up, and he might
some clarification about some things that I get questions asked about a good bit. So about screening, suspicion of a disability in a multilingual learner, are speech therapy services medical or educational? Are speech services academic or functional? Several questions like that. So we're going to start today by looking at screening first. All right, so when we talk about screening, the first thing I want you to really consider is what is the purpose? So what does IDEA say specifically about screening? Well, it says the screening of a student by a teacher or specialist to determine appropriate instructional strategies for curriculum implementation shall not be considered an evaluation for eligibility for special education. So the whole purpose of the screening then is to determine appropriate instructional strategies for implementation within general education, as opposed to, and this is key, determining whether or not the student should go forward with an evaluation, because the only way that decision can be made is by an IEP team. So as it relates specifically to speech, screenings cannot be pass-fail, because that could be interpreted as being determining of eligibility without the entire input of a team and without reviewing all of the data. So if there is a potential concern, again, then we can actually have the speech language pathologist observe, but sit in as part of that whole entire team to discuss all of the data. So then all of the data can be considered when we're considering whether or not to go forward with an evaluation, because again, that is a team decision. Another thing to consider is the hearing and vision screening. IDEA is very specific in their requirements, and also the OSIP memorandum as far as screenings cannot delay or deny access to a sufficiently comprehensive evaluation for a student suspected of having a disability. And so what that means is students cannot wait for months or even years to be provided a sufficiently comprehensive evaluation when there's a disability suspected. So the team can actually agree as a team decision to move forward with the evaluation while awaiting updated evaluation results or screening results if the team feels that there is not a functional impairment or a suspected impairment that would impact the findings of the evaluation. So for example, if the student passed the near vision section, they would be able to test, they would be able to see those test protocols. But if they didn't see past the far distance or distance vision, then that assessment really is not likely going to take into those findings. And so you may decide to go forward. Same thing with the hearing evaluation. If they needed that updated hearing screening, if the team feels like the hearing is functional, the team can decide to move forward with that evaluation while awaiting more definitive screening. But to be very clear, it is incumbent on the district to do everything in its power to get that subsequent hearing and vision screening done as quickly as possible. And that may include having the guidance counselor to help set up the appointment, setting up transportation, all of the above. Now, in terms of again, that intervention may not delay or deny. Again, the link is here. The Office of Special Education Programs and our department here at the South Carolina Department of Education, we provided guidance multiple times that, again, when the student is suspected of a disability, that evaluation cannot be delayed or denied due to waiting for that hearing evaluation, due to if they're continuing to receive intervention, and or even English language proficiency. We're going to talk about that more in just a moment, but go ahead. Next slide.
Angie, I'm sorry. You have a question, and I thought maybe we should answer it now because it's related.
Okay.
Can the IEP team in an REP, and I'm not sure what an REP meeting is, ask for a screening to determine if a full evaluation is necessary? And that was Karen Whitlock. I don't know, Karen, if you want to unmic yourself so you can maybe clarify.
Yeah. So you were saying we can do a screening if it's for instructional purposes, but sometimes in the referral meeting, that's the REP, the referral evaluation planning meeting, we hear something that kind of, nobody really had speech concerns, but sometimes somebody will say something that makes you wonder whether we should. And sometimes what we want to do is a screening to see whether the full speech evaluation is warranted. Is that appropriate, or do we just need to do the full evaluation from the beginning?
It really depends on the data. So here's what I will tell you about the screening. If you're only making that decision about whether or not to go forward with an evaluation for speech and language based only on the screening, then you're only using one point of data to make that decision. And that's not okay. You have to have multiple points of data. So you could do the screening as one point of data. You could also do observation. You can also do a records review. You can look at all the other
Right.
pieces and parts. But the whole purpose of the screening is to provide those instructional strategies for general education. It's not to determine who should and should not go forward with an evaluation.
Okay, I think I get it.
Okay.
Okay.
Okay, so on that vein, so we have brand new 2025 hearing and vision guidance. Now, what's very exciting about this hearing and vision guidance is its current guidance and its current forms. And you see both of those linked here, and you'll get a copy of these slides. But these documents, they were created with Vicki Ladd, who's the school nursing consultant for the State Department, with Robert Hill, who's the statewide deaf hard of hearing consultant, and Marty McKenzie, statewide vision consultant. And so we've been working on this guidance for a very long period of time, and it has finally been released. So it is all available for you here. So these are the new forms and the new guidance that is expected and aligned with current evidence and research. Go ahead. All right, so now let's talk about suspicion of a disability in a multilingual student. So when there's a question about whether or not there's a multilingual student who may have a disability, the first question to ask should always be, do we suspect a disability in their primary language? And the reason this is important is because in order for a disability to be present, there has to be documentation that says there's disabilities in both the student's language, primary language, and in their acquisition of English. And in both, if they speak both languages. So to be very, very clear, there is not a reason to wait until the student acquires English. If there's a disability in their primary language, it is highly likely there's going to be a disability in the second language. Now, especially when there's a concern about the area of reading, the team really has got to do due diligence to make sure that that student has been taught the differences between General American English. What are the sounds? What are the sentence complexities? What are the morphemes for English and the child's primary language? And have those differences been taught to the student? Because if you think about it, this makes a lot of sense, because if you're a student and you're learning to read, you only have to learn what the sounds you've been hearing and speaking, what they look like. But for a student who's a multilingual student, they have to learn these new oral language variety, this new sounds, these new sentence structures, these new morphemes, and what they look like in print. So it's really twice as much to learn. So to give you an example, and thinking specifically about Spanish, Spanish does not include the following consonant phonemes. It does not include the voice and voiceless th, like think and that. It doesn't include y or h or n or sh or v or z, all of those different sounds, as well as consonant blends. They also only have 5 vowel sounds in Spanish, and they're only the short vowel sounds, not the long vowel sounds. They also don't have the schwa. They don't have the vowel diphthongs. They don't have many of the R-controlled vowels. So again, when we're thinking about reading, if students have not been taught the sounds and what they look like in print, how do we know if it's truly a disability or if they just haven't been taught it? And so what you see here is an example here of if a student were missing the phonemes that are not present in English, present in Spanish, that's what this sentence would look like with all the things blocked out. And you tell me, would you be able to read, decode, and comprehend this sentence if you did not have that understanding? And that sentence is one that just says, I think that boy singing on television had a star on his green shirt. So again, that is what it looks like if you have not been taught the differences between your primary language, Spanish in particular, and General American English. And again, this is notwithstanding the fact that the sentence structure is different and the morphology is different. Go ahead. So when a team is considering whether or not, hey, do we suspect a disability? You have got to work with the multilingual teacher. And I'll be the first to tell you that several of us in OSIS have worked very closely with the Title III office to provide this information to our multilingual teachers to say, hey, how can we better collaborate? And so we've been providing in-services and training on that, I think, since early this fall. But the bottom line is to appreciate how much information that multilingual teacher brings to the discussion. So they are able to answer for the team. Again, when we're suspecting a disability or not, the multilingual teacher can say, hey, they're actually performing commensurate with their stage of language acquisition, meaning this is what we should expect them to be demonstrating in terms of verbal output. Also, how do they compare with other kids who are also multilingual and also learning to read and speak? They can also speak specifically to how the student is progressing or not to their ILAP goals, and if there's a need to revisit the ILAP, and also how the ILAP accommodations are working or if those need to be revisited. Go ahead. So again, there is training available. What you see here is you see a link to a form stack. If you want more information about training for when to suspect a disability in a multilingual learner, you also see linked here a key points document. So some of the key points. And again, this has been something that we've rolled out several times and we'll do again next year. We've already been asked to provide this information because when we share this information with districts, what we get back time and time again is that the gatekeepers to determining or suspicion of a disability in a multilingual learner, the gatekeepers are the speech language pathologists and the school psychologists. So we do not want to have that happening because again, delay or deny. We do not want to delay or deny an evaluation when we suspect a disability. Go ahead. So when we get all of this information together, there's a whole problem-solving process that we can go to. So there's several outcomes once we know all the information. So again, first we can say they are commensurate with their stage of language acquisition. They are doing what we should expect them to do. Or we may say we need more refined interventions. Or the team may say, let's update the ILAP. Or the team may say, hey, let's do some interventions because we're not really sure if we suspect a disability. So let's do the interventions and gather more data. Then we can make an informed decision. Or finally, as you see below, you can do interventions while you go forward with the evaluation. Because there's nothing that says you can't do interventions concurrent with the evaluation because that actually provides a really good bit of data. Go ahead. All right, so now let's talk about whether speech language impairment services, are they medical services, are they educational services, or are they both? Well, in order to answer this question, we have to look to IDEA. So IDEA requires documentation of adverse educational impact as one of the prongs of eligibility. IDEA also requires that as part of the evaluation process, we're gathering data to determine the student's educational needs. And IDEA states that the purpose of special education is to help the student meet educational standards. So yes, speech language impairment services are educational, but they can also be eligible for reimbursement if there's documentation of medical necessity. And that medical necessity is determined by how it's outlined in the South Carolina Department of Health and Human Services LEA manual. So to answer the question, are speech language impairment services medical, educational, or both? They can be both, but the way you determine this is you have to first meet IDEA criteria specific to educational impact. Go ahead. Now, in terms of academic or functional, there's this persisting myth. So we're going to play Mythbusters today. So there's a persisting myth that certain services have to be academic and certain services have to fall under functional. And that's not the case. There is no rule of thumb when it comes to academic versus functional, because the only thing that can determine that is the data. So while strengths are needed for both academic and functional, it is the individual student data that determines if the needs are academic or functional. Now, again, that said, since the data collected for both the purpose of evaluation as well as the impact statement related to impacts, if there are educational impacts, it is likely that more often than not, for speech and language impairment services, academic is what's going to be selected. Go ahead. So I've got an example here, 2 examples actually. So let's say, for example, the data gathered reveals adverse educational impacts related to the English language arts standards or the early learning standards for preschool age children. If that is the case, academic is the more appropriate choice. But in another example, if the data gathered reveals a functional impairment, for example, say difficulty expressing themselves when they're really upset or emotional, then functional is likely the more appropriate choice. But again, that's all got to be based on the data gathered. Go ahead. All right, now let's talk about a big question I get all the time. Speech language impairment. Should it be primary? Should it be secondary? Is it an embedded disability or is it a related service? So here we go. Step one. Step one to determine this is, did the student meet eligibility criteria for speech language impairment? Step one, did the student meet eligibility criteria for speech language impairment? If they did meet eligibility, then the speech services would not be a related service. And there's a lot of confusion about this because speech therapy personnel, we're considered related service personnel. And also we could provide, we're one of the, I think maybe the only, correct me if I'm wrong, Peter, I know you're listening, but the only ones who can provide both specially designed instruction as well as related services. We just have that flexibility under IDEA. So go ahead. So when looking at developmental delay in particular, if communication is identified as at least one of the qualifying areas of disability for developmental delay, we do not say that's speech language impairment, but rather the speech language impairment is an embedded part of that disability. It's not secondary, it's not related, it's embedded within developmental delay. Now, in this situation, again, we would be listed under developmental delay, and we would be a special education service. All right, Lisa, if you want to help me with this one. So there's a question that just popped up in the chat. If speech language impairment falls under multi-disability umbrella, or do we consider SLI secondary in order to provide services? You want to weigh in on that one?
Maybe, Karen, if you want to explain that a little more.
Believe it or not, this meeting was an hour ago. So
I believe it.
We have a student who has cerebral palsy, which fits under orthopedic impaired. She's also mildly intellectually disabled, and she's also got a speech language impairment, and she would also fall under other health impaired because of her ADHD. So we decided that she met eligibility under the multi-disability category because she meets the eligibility standards under all 4 of them. Right. But what we didn't know, and we got 2 different answers from different members of the team, whether SLI has to be considered secondary to the multi, or if we find her multi-disabled, then, and one of those multi-categories is speech language, are we still able to serve them under speech language?
Absolutely. So when you're saying multiple disability because of the 4 disability areas that she qualifies in, speech being one of them,
Mm-hmm.
SLI would not be separate. It would be another way that it's embedded in multiple disabilities. Just like you're going to serve her for any orthopedic issues the student has,
Right.
plus any intellectually disability issues. Same with
Right.
speech, same. So it would be embedded.
Okay, that's what we thought, but I figured you brought it up just in the right time.
That's awesome. We aim to please.
All right, go to the next slide. Okay, the next question that I get a lot is, okay, so should speech services automatically be added to an IEP for a student who's been identified with autism spectrum disorder, even if they don't meet criteria for speech language impairment? The answer to that is no, because there are no blanket decisions based on the category of disability. All decisions are made by the team and based on individual student data. Go ahead. All right, now here's the question about, is it special education or is it related service? So to answer this question, it really helps to frame it based on what IDEA, how they define special education and related service. So special education is speech therapy services, as you see here by IDEA, they're considered special education unless they're related service under state standards. Related services, here's the difference. Related services are necessary in order to help the student, in big, bold highlight here, benefit from special education. Benefit from special education. So that's one of the ways it's different from special education, because special education is designed to help support access and progress towards the general education curriculum. Go ahead. So what do we mean when we talk about benefit from? So there's a series of 4 questions that I think are really helpful to consider. These are not part of IDEA, just some things for the team to consider. So what do we mean when we say benefit from? So again, the big thing to think about in the context of IDEA is, how would this service help them access and progress with the special education program and make progress towards the special education goals? So in other words, the related service needs to support the student in being able to advance appropriately towards attaining annual goals, or be involved in and make progress toward general education curriculum and participate in extracurricular and other non-academic activities, and be educated and participate with children who are disabled and not disabled. Go ahead, next slide. A second question or another question to ask is it that the unique skills and expertise of that discipline, so we're not even saying just speech, could be PT or OT as well. Do you need that specialty training and expertise? Or could someone else provide that training? In other words, what aspect of the special education program, as we just outlined in 1, 2, and 3, requires that related service so the student can benefit from the special education program, and which team member has the expertise to address them? The other part of that to consider, though, is there's going to be overlap. So when you see that there's overlap, then we have to look towards LRE, least restrictive environment. Go to the next slide. So when we think about least restrictive environment, we have to appreciate that there's a whole continuum of services that are available under IDEA in order for a student to receive a free and appropriate education. So that continuum of services means direct services, indirect services, and supplementary services. So if we're saying that there's overlap between perhaps what a speech language pathologist could do and a special education teacher, another special education teacher, because remember, speech pathologist, if you're providing a service under IDEA and that student was eligible, you are a special education teacher. So if there's overlap, we need to look at what that continuum of services looks like in order to work within the least restrictive environment. Go ahead. We also need to look at, what does the data say? What does the data say that these skills are needed? How will it help the student benefit from the special education program? So another piece of this too is, believe it or not, this is a long-standing myth, but occupational therapy services can be a related service to speech. So let's say the student only has a speech language impairment. Occupational therapy can be a related service to speech language impairment if it is necessary in order for the student to benefit from the special education program. Now, critical to understanding this is, what is the expertise of that occupational therapist that the speech language pathologist does not have? And that would be the expertise in sensory and fine motor and processing deficits. And again, does this data reveal the student needs that instruction from that related service provider in order to progress towards the special education program? Go ahead. And then finally, again, as IDEA talks about, related services are supposed to help benefit from the special education program. So what is the plan for collaboration? Because if you're really working towards helping the student benefit towards the special education program, there really needs to be very clear-cut collaboration between the special education teacher and related service provider in order to ensure that these services are supporting and are successful in contributing to the special education program. Not to mention, what does this look like on a continuing basis? So with that, I will also say IDEA does not require discipline-specific goals. That is not a thing in IDEA. So that means that you could have one goal that is supported by both the related service provider and the special education teacher. And the beauty of this, the benefit of this, is that we're ensuring that these skills are addressed across all educational settings. And so progress monitoring, implementation, these things occur throughout the student's day. And so we're really helping to make sure that the instruction we're providing is more effective and efficient when we're looking at it from that standpoint. Go ahead. Now, another question I get a lot is, okay, how do we discontinue related services? Well, if the student was never found eligible for a disability, but you've added a related service, there's not a requirement to hold a reevaluation review to discontinue a related service, because by definition, the student was not found to be eligible under IDEA in the first place, in whatever that category was. Now, as part of the IEPT meeting, we do need to have the data that supports that it's no longer needed, that related service is no longer needed to help that student benefit from the special education program. But that data does not have to be a comprehensive evaluation using standardized evaluation tools or non-standardized evaluation tools. It can just be a variety of data. Go ahead. Now, speaking of data, this is important. So this is important as you're looking towards your end of the school year and your allocations for next year. So I wanted to go over some of the data specific to speech language pathology. So speech language pathology in South Carolina and also in the United States as a whole is the second largest category of primary disability. Speech language impairment is the second largest category of primary disability. Now, I'll lay it out here what this looks like. So specific learning disability is about 36%, little more than that. Speech language impairment is a little over 16%. OHI is a little more than 15%, and autism spectrum is about 12, almost 13%, although it's been increasing significantly. Now, the reason this is important, and when you're thinking about your allocations, is because speech is not only a primary category of disability, as we've just talked about. It could be secondary, it could be related, it could be embedded. So if we're only looking at the data just on the primary category disability of speech language impairment, that would show that we're only serving, speech language pathologists in the state are only serving about 18,000 children in the state. If we were only serving 18,000 students in the state, we would only need about 310 to 315 SLP statewide. but we have about 1,200 SLP statewide because we also serve students with speech as secondary related and embedded categories of disability. So that's a really important piece of data. Now go to the next slide. Now let's look at data about our allocations and what are the disability categories that speech language pathologists support. So what we know over 2 years worth of data, so from 2021 to 2023, what have the increases looked like? So in speech language impairment, we've seen a total increase of about 2.64% just in speech language impairment primary. School age has barely increased. It's 0.33%. But pre-K speech language impairment has increased 20.55%. Now, speech language pathologists also very frequently support specific learning disability. Why? Because oral language is the foundation for written language. So when the oral language is off, very frequently the written language is off. So that's why we do a lot with specific learning disability and dually serve these students. But that number has not gone up significantly. However, let's go to the next slide. As you see on this slide, again, looking at 2 years worth of data, we see some significant increases. So developmental delay has had a total increase of 7.63%. School age developmental delay is 1.74%, but it's the pre-K speech language impairment where we need to be looking. That has increased by 23.33%. Now let's look at the autism spectrum data. We've had a total increase of autism spectrum across 3 to 21 of 25.17% in 2 years. In school age, the increase has been 21.30%, but in pre-K, we've had a 59.25% increase in preschool autism. Go to the next slide. And it's not like looking like it's going to get better, because here's the data on Part C. So Part C, who are the kids that are still on their way to us? So in Part C, there's been a 30.51% increase in children birth to 3. That's from pre-pandemic to post-pandemic. So that's over a 3-year period. So again, it's not looking like it's going to slow down. Go to the next slide. So that is one of the reasons why this in-person training has been offered to all districts, and it's on the Standards of Evaluation and Eligibility document, so the SEED document specific to speech language impairment, in addition to what is the speech language pathologist's role in evaluation and eligibility for developmental delay and autism. And currently, about half of all the districts in the state have either received this training or have planned for it in the fall. So they're starting to sign up. So if you haven't signed up, again, there's a link there where you can request that training. And I'll tell you, as I've provided this training, one of the number one things that seems to come across as the most appreciated isn't even the SEED part. It's not the state part. It's the requirements of IDEA specific to evaluation. Then it's reviewing that criteria for speech sound disorder and what are the current norms? How do we determine the presence of a speech sound disorder? The other one that's very appreciated is in the area of language development. How do we determine a language development? And especially, what do we need to know about standardized assessments and the limitations of standardized assessment? But the other third thing that I think has probably been most well received is information about evaluation of preschoolers. Because as you special education directors know, we're seeing a huge increase in preschoolers with a disability, but we're also seeing an increase in their severity. So what do we need to know? The other part of this is in this training, you'll see that number 5, 6, and 7, those are all, again, those are looking at developmental delay and autism. So most districts have invited their school psychologists to attend that afternoon part. because these evaluations are collaborative. And there's a lot to be said to make sure we are on the same page when we're conducting these evaluations. All right, go ahead, Lisa. That's it. So I really appreciate you giving me a few minutes of your time to provide some clarification. My email was on that last slide, and then I'm here to take a few questions before we wrap up.
Thanks, Angie. Wonderful as usual. I don't see any questions so far. I'll keep my eye on the meeting chat. If anybody thinks of anything, you know where to get in touch with Angie. So feel free to drop her an email anytime. You might go back to your district and think of something she said and want some clarification. So reach out to her. Our next information session is May 20th. And winding down the school year. I mean, it's hard to believe it's May already. But that's all we had for you today. You know, we know May is a tough month for everybody, and you got a few weeks left, and it's a lot in a little bit of time. So if you need anything from us, you have questions, just reach out. We're here and happy to help. And Peter, if you want to end the meeting.
Sure. I was just going to add that for May 20th, what we're anticipating now is that we're putting together a presentation that we basically the intended audience would be school site administrators, basically setting talking about some basic things that would help improve special ed programs at school sites. And so on May 20th, we were just going to run it by you guys. It's a presentation that I'll be doing at the SCASA I3 conference this summer. Hopefully getting some school site administrators there to attend that session. And it talks a little bit about, school site administrators being familiar with the dashboard in EdPlan SC and some of the tools that are in there, and using high quality instructional materials, that have already been selected, particularly for ELA, for the state, and how to use those in specially designed instruction at their school sites, and promoting that kind of collaboration between special ed and general ed teachers. And so anyway, May 20th will be a chance to show that to you guys, and then to talk about we might also record it, so you might be able to use it as a tool at your school districts to encourage your school site administrators to help promote the programs that they have there for students with disabilities. So that's what we're anticipating on the 20th, unless, obviously something more urgent pops up. If there's some pressing news that we have to share, hopefully we'll get good news on our allocation, and everything will go as planned. But anyway, like Lisa said, we know that you guys are doing a lot. This is a particularly busy time of year for all of us. We appreciate all that you do for students with disabilities, and we look forward to seeing you again soon. Thank you.
Thank you, everybody.